This week is basically an exercise running through options for repealing and replacing the Affordable Care Act. Basically, Majority Leader McConnell's kind of ticking through these bills to see what could pass. So far, everything's failed.
The motion is not agreed to.
The amendment is not agreed to. The motion is not agreed to.
Republicans voted down a repeal-only bill. 7 Republicans actually opposed that. And so now what we're on to is what's called a vote-a-rama.
The Senate will resume consideration of H.R. 1628.
The idea of this vote-a-rama, which it was starting on Thursday and going through Thursday night, was giving an opportunity for Democrats and Republicans to propose changes to the law.
Here in America, we spend far, far more per capita on health care.
Our system is not affordable. It's not portable.
The Republican leader has a last-ditch plan.
Replacing Obamacare is a means to an end.
Democrats are really viewing this as an opportunity to require Republicans to cast some really hard votes. They're probably going to propose things that would enhance coverage, that would expand coverage, and they're going to dare Republicans to vote against those elements. On the reverse side, Republicans want to kind of trick Democrats into voting for things that might make them more vulnerable with voters. I know that Steve Daines of Montana is introducing a bill for a single-payer system to kind of dare them to vote for that. This whole exercise is limited by the amount of time that senators have to debate, so it will eventually have to wrap up probably around Friday morning, but certainly go through the night Thursday. And then at the end of all of that, the thought is that the Senate would take up this so-called skinny repeal bill. And the thought is that this may be the only bill that Republicans can muster 50 votes to pass. And what it would do is repeal just small parts of the Affordable Care Act. So the individual mandate to buy health insurance, the mandate for employers to offer it, and then possibly just one of the ACA's many taxes, the medical device tax. It also may pull back a prevention public health fund in the law, and then may or may not include defunding of Planned Parenthood. But this bill would be significantly smaller than some of these other repeal bills that Republicans have attempted, but it may have a better chance because it wouldn't enact these deep cuts to the subsidies or the Medicaid part, which had worried a lot of moderates. There are some real problems with just repealing the individual mandate, but leaving the rest of the insurer regulations in place. Basically, it means that the healthy people no longer have this incentive to enroll in coverage. And so fewer healthy people would enroll. That would make the insurance markets full of sicker people, which would then prompt insurers to raise premiums for everyone. And this could result in fewer people being covered. So the CBO has estimated that next year, 16 million fewer people would have health coverage than under current law, and it would also cause premiums to go up by about 20%. And so that's why you see health policy experts, both liberals and conservatives, warning that if you just repeal the individual mandate but leave other elements of the Affordable Care Act in place, this could really cause a lot of chaos in the individual market and in the marketplaces created under Obamacare.